Greetings and salutations, coming at you live from the home of the two-time Super Bowl champion Philadelphia Eagles and the birthplace of American democracy and the word John, Philly. Uh, Welcome. My name is Mike Lee. I'm the executive director of ACLU of Pennsylvania, and I'm so excited that everyone has responded to our call to action to come to tonight's tele-webinar, tele-town hall. We have an awesome panel here to talk about Medicaid and the importance of keeping Medicaid. But our civil liberties are being tested, but not just our civil liberties, also our collective values. And there's an old saying, show me your budget and I'll see what you value. And that doesn't ring more true than today's climate. We have a contest underway in Congress about our values. Uh, and it's about dismantling our social safety net that millions of people rely on for their health and well-being. Cutting Medicaid is unfortunately at the top of this list. Cuts to Medicaid would have a devastating impact on tens of millions, including more than 10 million people with disabilities, which makes Medicaid one of the largest providers of healthcare to people with disabilities, including those with mental health conditions. Medicaid is a lifeline for people with disabilities. Beyond healthcare, Medicaid is the primary payer of home and community-based services, something that gets alphabet souped as HCBS, for nearly 8 million seniors and people with disabilities. This includes those with complex care needs who depend on these services and support to do things like get out of bed, go to work, and most importantly, live in their supportive communities rather than being warehoused in costly, isolated institutions. The ACLU has been working at a national level for months to save Medicaid, recognizing that this access to healthcare coverage enables individuals to participate in the economic, social, and civic life of the nation, advancing equal opportunity and personal liberty. We have raised our concerns over drastic cuts to Medicaid that disproportionately harm, and you're not going to be surprised whenever you hear the words disproportionately harm, it's usually followed by this list. These cuts will disproportionately harm low-income people, racial and ethnic minorities, women, people with disabilities, and underserved communities. And they're already face substantial obstacles to obtaining quality health care. The ACLU has previously condemned congressional efforts to undermine access to health care. We have stated that access to health care facilitated by insurance coverage enables individuals to participate in those things. On May 22nd, a week ago, the House of Representatives passed a budget reconciliation bill, the one big something. It was decided by 215 votes to 214 votes. Every vote counts, so count every vote. This bill included significant impacts to Medicaid. These new policies are estimated to decimate federal support for the Medicaid program by at least $600 billion over a decade. This will cause more than 10 million people enrolled in Medicaid to lose their health care coverage. Over 3 million Pennsylvanians, or 23% of the state, are covered by Medicaid, the largest population being kids. We have an awesome panel and we have a lot of information to get to. And I'm really going to do my best to try to keep us all on track while keeping everyone as informed as possible about the consequences of this reconciliation bill and what we can do as citizens and concerned individuals to take action. I have a wonderful panel that includes Dwayne Heisler from Action Together NEPA, Jennifer Garman, the CEO of Disability Rights PA, Adam Hosey, the Policy and Political Director for Planned Parenthood PA Advocates, and Elise Aguilar, Senior Director for Federal Relations for ANCOR. Thank you all for joining me here today. You all ready? All right. So just to lead things off and continue to set the current landscape for things, kind of an open question to everybody, but can you explain some of the specific Medicaid cuts being proposed and how these cuts impact Pennsylvanians? Maybe Dwayne, to kind of break the ice, I'll just cold call you.
Sure. Thank you, Mike. And I'm really pleased to be here. Thank you, ACLU, and glad to be in the company here to discuss this. It's obviously very serious. And Mike, your list that you had, I'm glad you followed it up with talking about children, because children are also disproportionately affected by these cuts to Medicaid and by the bill on whole. I mean, when we think you gave some national statistics and what it looks like in terms of coverage in Pennsylvania, but the estimates that are coming from the Pennsylvania policy, which in addition to Action Together NEPA in Northeast PA, my day job is the Pennsylvania Policy Center, is that our studies show that it's going to strip about 580,000 Pennsylvanians from their health care. And I know this is all about Medicaid, but we'd be remiss not to mention that it would also take food off the table of 193,000 individuals in our state too, because of what's happening to the SNAP benefits. It would cost over $1 billion annually to the state of Pennsylvania just to maintain the food assistance programs. And then, of course, there's the impact on the federal budget too of $3.8 trillion. So there's all kinds of impacts that go all the way around. And just as a note, it's been very clear lately, we've known it for a while, and we were hearing more from our governor that the Pennsylvania doesn't have the money in their budget to cover these cuts that are happening. It's just not possible. We're already running a deficit, and which means that it could move us more towards a fiscal cliff. So how's that for an icebreaker there? But just some information on the state.
Thank you, Dwayne. And Jennifer, as it relates to your work with Disability Rights Pennsylvania, can you just talk about how some of these cuts, potential cuts, could impact the population you work with?
Sure. Thank you, Mike, and really glad to be here this evening, but not happy to be talking about this proposal. So for the disability community, Medicaid is healthcare and it is access to the community. It funds people throughout their lifespans. You talked about children, seniors, and adults with disabilities. So if there are cuts to Medicaid, the entirety of the disability community is really at risk. For kids and students with disabilities, Medicaid funds services for kids with healthcare needs so that they can have the supports that they need to live in their homes, as opposed to in institutions. It also provides support in their school settings. If a student has an individualized education plan, they receive supports under Medicaid as well for things that are both educationally and medically necessary. So it is also funding and ensuring integration of students with disabilities in school settings. Medicaid funds 59% of nursing facility residents. It is funding long-term care for the disability community. And it is also supporting seniors to avoid being institutionalized or ending up in nursing facilities so that they can remain in their homes, they can remain in their communities, and be supported with in-home supports. For people with intellectual and developmental disabilities here in Pennsylvania, we already have a really significant waiting list for services. So any cuts at the federal level are going to mean that services are going to need to be cut, or that people are going to be waiting even longer for services. And just one last note, people with mental illness, people with serious mental illness, 39% of Medicaid enrollees in Pennsylvania have a mental illness. We chronically underfund our community-based mental health system. So any cuts to Medicaid funding will just increase the waiting time that people have to access mental health services that they need to get and stay well. So it's, on the whole, just a devastating proposal for the entirety of the disability community throughout the lifespan. and no matter what type of diagnosis someone has.
Just devastating. And Elise, from your perspective with ANCOR, which is, I believe, based out of DC, is there anything else you want to add about how these populations are being impacted by these cuts?
Thanks so much. I really just want to build on everything that Jennifer said, how much people with disabilities rely on Medicaid. ANCOR is based in DC, but we represent community-based providers of services for people with intellectual and developmental disabilities across the country, including in Pennsylvania. Our member PAR is the state association in Pennsylvania, and not only do they serve and support tens and thousands of individuals with disabilities across the state to be supported in their homes and communities, but they also collectively employ over 50,000 direct care workers that help support people with IDD to do all of those activities that we talked about, whether it's helping somebody get dressed in the morning, or whether it's helping somebody really perform community integration, whether it's helping with employment supports, whether it's helping people connect with their family and their social networks and their communities, whether it's facilitating volunteer opportunities. All of these things are made possible through the Medicaid Home and Community-Based Services Program, and all of them are reliant on a really robust workforce of direct care workers. So I just wanted to take a moment to talk a little bit more about how these provisions in this legislation could impact the direct care workforce. In particular, again, in all of these provisions that we're talking about, when we're talking about reducing funding for the state, when we're talking about squeezing state budgets, we're really concerned about the implications that could have for the funding of home and community-based services. But there are also a lot of provisions in this legislation that really add to administrative burdens, additional red tape, making it more difficult for people to access Medicaid. Things like requiring people to have more onerous processes in place to just become eligible for Medicaid or to remain eligible for Medicaid. Additional requirements around requiring people to prove that they are working a certain number of hours per month in order to be eligible for Medicaid. Of course, these impacts could be really broad, but we are really concerned that they could, in particular, impact direct care workers, especially as those tend to be folks that don't work really regular hours, that have more flexibility in their schedules, are shift work or part-time work, that those folks can really, really be caught up in this additional red tape and these additional administrative hurdles. And when we're talking about a workforce and a system that's already under-resourced and underfunded, any of these sort of added administrative burdens can be really detrimental, not only to the individuals receiving Medicaid, not only to people's access to really critical health care, but to the workforce that supports people with intellectual and developmental disabilities and all of the folks that receive supports in their homes and communities. So it really has this sort of snowball effect and could be really, really harmful to really this already fragile system of services that we have in place.
Wow. We're only 12 minutes in and I've already learned like 7 things. But uh the value that Medicaid keeps families together, oh my gosh, unbelievable impact. Instead of people focusing on receiving their services, they're now going to have to focus on filling out forms to stay compliant. And instead of paying for these services, we're paying people to check to see if people are filling out the forms correctly. Oh my gosh. I hope I got that all right. But Adam, I want to switch gears a little bit and talk more specifically about access to reproductive justice and services. What immediate effects do you anticipate these cuts, potential cuts, will have on recipients and their access to healthcare services?
Thanks, Mike, and thanks so much for having me tonight. Parenthood is very specifically named in this bill to be "quote unquote" defunded. Now, no federal dollars can actually go to fund abortion, but when we provide patients who utilize Medicaid care, we do get funding, we do get reimbursement, things like that. So that is the vehicle in which they are doing this. We are being targeted because we provide abortion care in places where it is legal, like in Pennsylvania. So we have lawmakers that are willing to sacrifice this affordable health care for 1.1 million people across the United States utilize Planned Parenthood and Medicaid. In Pennsylvania is about 30,000 patients. So they are opposed to us ideologically and politically, and they are willing to strip healthcare of folks because of that. And we know what happens when centers are defunded. The most recent estimate is that nationally, 1 in 4 Planned Parenthoods will have to close if this bill goes through as it is written. In Pennsylvania, we only have 20 Planned Parenthoods as it is. Back in the 70s, we used to have 175. So they are chipping away, chipping away, chipping away at this really important healthcare access point. People should have an abundance of choice when they think about their healthcare provider. I'm obviously biased, but I think Planned Parenthood provides some of the most compassionate care around. It is without stigma, without judgment. And when we defund these centers, cancers go undetected, STIs go untreated, birth control is harder to get. And the entire public health infrastructure of communities break down, especially for folks who are on Medicaid. So one of the talking points is that, oh, well, if Planned Parenthood's closed, folks can just use like federally qualified health centers. Well, in Bucks County, there aren't any. Like, it is us in Bucks County that is doing that. So folks are going to have to travel farther. And when it comes down to it, they're just not going to get some of that preventative care. And we know that will cost folks more down the line. And also, we aren't going to be able to detect in really important things ahead of time. So every year, we provide 9 million services to over 2 million patients across the country. And when we are thinking about some of this red tape too, I do want to lift up this 6-month recertification requirement again, and the work requirement. So even this morning, we're outside a congressman's office. We were lodging formal complaints about their vote for this big ugly bill. And one of the constituents there was talking about how she is in her 50s. She's not eligible for Medicare. She is on Medicaid, and she takes care of her dying parents right now. She utilizes Medicaid for her health care, and she doesn't have time to work because she is taking care of her parents. She is a full-time, unpaid caregiver. So if this bill were to go through, she would just be stripped of her health care. And that is what this bill is doing. And it's not just her. We are hearing these stories across Pennsylvania and across the country.
Wow. And Adam, I know Dwayne talked a little bit earlier about Pennsylvania not being able to meet some of this financial burden and strain if these cuts were to go through, but is there anything else about that financial burden that you wanted to add on to?
Yeah, certainly. I think other folks on the panel can chime in here as well, but if we are not getting those federal funds for Medicaid, someone's going to have to pick up the bill. It is billions of dollars, and Pennsylvania just doesn't have it. When we are thinking about what we need to pay for, like school funding, for example, there's a constitutional mandate to fund our schools in this state. We're not going to be able to do that if we don't have Medicaid funding, if this bill goes through. There's also like another logistical piece when we think about the 6-month recert. Imagine if you had to go to the DMV every 6 months just to re-up your driver's license. We all hate going to the DMV because there are long lines, it's slow, it's burdensome. Folks who are on Medicaid have to recert every 6 months. Folks are just not going to do it, and they're going to lose their health care that way as well. The state is estimating millions of dollars to upgrade their own systems, to hire new people, if they have to continue to recertify people to get just their basic human right, which is healthcare. So it's an incredibly expensive process because folks should still be getting healthcare, but someone has to pay for it.
Wow. Yeah, and that story you shared really stuck with me too while you were speaking about the financial burden, because there's also that human burden of these problems aren't going away and these families still want to stay together and support each other. And we need to do what we can to keep people together. I don't know if this is new or not, but are there any states or other states that have experienced similar proposed Medicaid cuts, maybe on the state level, and anything Pennsylvania can learn from them?
Oh, absolutely. Yeah, I'd like to jump in here on this.
Go for it,
Sadly,
Dwayne.
there are quite a number of states that have gone down this path, and I have a few examples. The first one that comes to mind is Arizona, where they had Medicaid coverage freezes. And so what they did was they froze the enrollment in the Medicaid expansion program for childless adults in 2011. And this was because of some budget shortfalls. And what it meant was 100,000, let me turn off my phone here, 100,000 adults lost their coverage. And the impact that it had was basically it increased the uncompensated care for hospitals, like Elise spoke to. There were higher emergency room usage, and there were poor health outcomes for low-income adults. And so the lesson for Pennsylvania is that cutting targeted adult expansion population backfired and shifted costs to hospitals and really worsened the community health. And that the savings that they were expecting on the budgets were really short-lived, short-term. In Texas, they are chronically underfunding. They regularly mandated like one of the lowest Medicaid reimbursement rates, and some really strict eligibility criteria kind of leans into a little bit of what Adam was saying. And what that meant for what it means for them are there's a very low physician participation rate. Patients struggle, even though they technically have, qualify for the care, they're not getting it. And then hospitals absorb this incredible amount of uncompensated costs. And so that's another lesson for Pennsylvania that, cutting provider payments or access really harms the whole infrastructure, and it weakens the provider network and creates kind of a two-tiered system where Medicaid patients really struggle to find the care that they need. The third example I would say would be Maine. Between 2011 and 2014, they had Medicaid rollbacks under Governor LePage, who was there at that time. And when they did that, when they eliminated this coverage, it affected over 70,000 residents. How they did that was tightening the eligibility and refusing the Medicaid expansion under the ACA, which we did here in Pennsylvania. And that increased the medical debt and sadly the hospital charity care. Health outcomes declined, especially among the poor. And there was a political backlash to all of that that happened. So the lesson for PA is like popular resistance is real when those cuts are visible and when it hits working families. So there are real life consequences that happen. Another one would be Tennessee. So like I said, there are plenty of examples of this. In Tennessee, their plan is called 10 Cares, TENN Cares, and they did some massive rollbacks. They were facing some budget pressures, and they cut 170,000 adults from 10 Care. And basically it reduced their benefits really significantly. And one of the first impacts were that the mortality rate really rose among affected populations. Hospitals reported spikes of unpaid emergency room visits because people were putting off getting care and then until they couldn't anymore and had to show up at the emergency rooms. And eventually the state faced a bunch of lawsuits and public commendation for all of that. So they were condemned in a big way for what they did. And then the final example, and I just heard this story kind of popped up again in the New York Times, is about Arkansas. And it goes back to 2019, but someone just this past week, or maybe last week when the bill passed, they were talking about it in the New York Times. In Arkansas, they were the first state to implement work requirements, what Adam was speaking about, and others mentioned it as well, work requirements. And what that meant was 18,000 people lost their coverage in less than a year. And it wasn't because they weren't employed, it was failure to report. And there were even issues with like when you could do it, like the website would go down during certain hours and then it just crashed and people were jumping off. And so basically, and also during that time, it did not increase the number of people who were working. Like one of the goals was to get people to work, and it didn't do that. There was widespread confusion. There was red tape that caused the lossage, and the federal court actually then struck it down. So there are plenty examples. Yeah.
Yeah. And, some of those currently employed people who might not be employed if these cuts go through are the healthcare providers. And Elise, you talked about them before, but could you just expand more on that point just that Dwayne just raised about we've seen how this has played out before and how these impacts will impact Pennsylvania?
Absolutely. A lot of this, I think Dwayne really hit on in a lot of those examples that he shared. But when we talk about what the cuts look like to states and how states are going to be forced to make up those shortfalls in their budgets, they're left with, few options. They can raise taxes, right? Or they can look to reducing services and the number of people that can receive services in the state, or they can look to reducing provider rates. And when we look at what happens when we reduce provider rates, we find a lot of those same examples that Dwayne shared, that providers are not able to continue to receive patients, and in many cases end up closing altogether. This is particularly acute in rural areas where there might be maybe just one hospital serving the entire population there. If we look at reducing reimbursement rates, if we look at fewer providers in those hospital settings, a rise in uncompensated care, in addition, those hospitals are going to go under. And then what happens to the healthcare for everyone in the community, right? There's a lot of rhetoric around this is not impacting a vulnerable population. This is only impacting certain people through the expansion population or certain able-bodied individuals. But the impacts are very real for entire communities, and they can be devastating. Just looking through the lens of providers of services for people with IDD, we already know that provider rates are not sufficient to support the level of services that people need. Jennifer shared this earlier. There are waiting lists that are thousands of people long, that are years long for people waiting for services. If we are reducing provider rates, it means fewer providers are around to accept people. So even if people are eligible to receive those services, there's simply nowhere for them to go. And that's a really cascading problem. I did want to highlight on one other really state-specific example on the impact of cuts to Medicaid, specifically for home and community-based services. I know we talked about this a little bit earlier, but we have a lot of data that looks at what has happened historically when states have less federal funding for their Medicaid program and what that means for people receiving home and community-based services, whether it's people with disabilities or whether it's older adults who want to age in their home and receive supports in their homes. Back in 2010 and 2011, so in the wake of the Great Recession, every state received a bump in their federal match rate, so increased federal funding for their Medicaid program. When that was rolled back, when that funding expired in 2010, 2011, 2012, there's data that shows that every single state, in order to make up that difference, that budget shortfall, looked first to their home and community-based services to make cuts. Every single state made cuts to their home and community-based services. Some looked at cutting the dollar per person, so just reducing the amount of funding for those services, and some actually just cut the number of people that could receive those services. In Pennsylvania, we have data that shows that the state cut the number of people enrolled in home health services by 52%, just as a result of rolling back that federal funding and looking to those shortfalls at the state level. So we can only looking back to look forward, we can only imagine what's coming down the pike as states like Pennsylvania are forced into making these really, really tough decisions.
Yeah, and if I could just build on what Elise just said, just to be clear, with Medicaid, it's the mandated entitlement is to the institutional level of care. Home and community-based services are optional. And so what Elise just said around the funding, if funding is cut at the federal level, the state will still be mandated to spend on long-term care and the institutional level of care, and will be forced to look at the home and community-based service system to make cuts. You can expand that out to the mental health service system as well, the cuts that Elise mentioned back around 2011 that happened here in Pennsylvania. Our systems have, quite frankly, never really recovered from. We are still seeing, we're seeing kind of a few things here in Pennsylvania: a rapidly aging population, an increase in what we call acuity, or the needs of people who are coming into services, as well as funding that has not kept up over the past 10 to 15 years for funding, particularly if you go back to those cuts. And so the system is certainly not in a position right now where we would be able to absorb any reduction in funds from the federal level. It will impact the services available to people, and we have a really robust service system here in Pennsylvania, even if we don't have enough staff and workers to support people. So we would hate to see Pennsylvania take any steps backwards in that regard.
Yeah, it sounds like we don't need a reduction. We need an increase in this vital funding and the important services that they provide. But I've been so busy learning and asking my own questions that I forgot to remind the audience that if you have any questions, you can use the chat feature to put your questions in there, and we hope to get to your questions as well. I want to change gears a little bit, because now that I know a little bit more, a lot more about the importance of Medicaid and the spectrum of care it provides and keeping families together and communities safer. I want to talk more about taking some action because these cuts really need to not go. So, Dwayne, I think you mentioned in your beginning you wear a couple of hats. And I think one of those hats might have some information to the audience about what role public awareness plays in influencing decisions about Medicaid cuts and how we can educate our fellow community members on this issue.
Right. First of all, I'm really glad you asked this question because there's been pushback to all of this since, well, frankly, since the election last year, when people realized the writing was on the wall and this was what was going to happen. And quite frankly, also because of the upcoming the expiration of the Trump tax cuts and everything. There's a direct correlation with like what's getting cut and who's getting money here. Just to be frank about it, we're talking about cuts to safety net programs that are happening in order to send billions of dollars to billionaires. That's the clearest thing. And getting the word out about that, like you said, Mike, it was really important. And let me just say that on January 9th, the first event was held in Northeast Pennsylvania. So it's Action Together, NEPA, Northeast Pennsylvania. And that's where that happened. And Action Together bottom line that event on the 9th in Pittston. We partnered with Pennsylvanians Together, Pennsylvania Policy Center, which includes Planned Parenthood as well, and also UFCW. We did it at a union hall because unions are so critical everywhere in the state, but certainly in Northeast PA. But to your point about how does this influence it, I'll tell you right now, it was very clear right from the beginning that this big ugly bill, I'll work on what Adam called it, the big ugly bill, was supposed to happen really quick and really fast, and they were going to vote on it and they were going to get it through. That was in January, right? And here we are now, and it's, we're going into June and it still has not passed. And the reason why it has not passed has been all of the community conversations, town halls, letters, so important, letters to your members of Congress and to the Senate. It's been because of vigils. It's been because of all of these events, protests. It's been everything. There's even been, and we started to move into this a little bit more here at the Pennsylvanians Together, house parties to just share within our community the impact that this is going to have in every corner of the state of Pennsylvania. There have been, I know just Pennsylvanians Together alone has done probably about 60 events since January all over the state with focuses in key areas where we think that a legislator might say, hey, let's put the brakes on this. This is really affecting my constituents here in Northeast Pennsylvania, for example. So I think that that kind of sets the stage. And honestly, if you haven't heard about any protests or rallies or things happening since January, I don't know where you are in the country because they're happening all over the place. But let's say that one of the first events happened right here in Pennsylvania and right in North Pennsylvania. In fact, in the coalition work that I'm involved with on the federal level, they were amazed at what was going on in Pennsylvania because they knew the decisions made by our legislators in our states were going to be really critical in this fight, and they have proven to be so.
Yeah, what great examples of nonpartisan action. Um, from a stakeholder perspective, and this is kind of an open question to everybody. Um, so from stakeholders, including the healthcare providers, patients, policymakers, is there any collaboration going on to create unified front in response against this? I know, Dwayne, you commented on it just now from a community and Northeast Pennsylvania perspective, but Jennifer, Adam, or Elise, do you have any additional information you can provide?
Yeah, we are mobilizing providers, healthcare workers, nurses, doctors, et cetera. And they are coming out of the woodwork. So one of our biggest constituencies is actually like medical students. So these are folks who are in medical school, in residency. They are working incredibly long days, and then they're keeping on their white coat and coming out and speaking out against these cuts, because that is how serious these are. We're also mobilizing patients to the best extent that we can. We have folks inside of our health centers that provide educational materials to patients. So as they come in and they get a pap smear or an STI test, and then as they're walking out the door, we're talking to them about these cuts and what could potentially be lost in these communities.
So I think for the disability community, there's been a lot of focus both on education for policymakers to make sure that I think both policymakers and the public understand all of the ways in which Medicaid supports and empowers people with disabilities. And part of what the community and organizations have been really focused on is storytelling. So trying to help empower people to share their stories of both what Medicaid means to them, what it has allowed them to do in their lives, the ways in which it impacts their lives every day, because it's powerful, number one, and I think generally people don't always understand. They rightfully think of Medicaid as healthcare access, but there are so many other ways in which it interacts with people throughout their lifespan and supports people. So I think there has been a really big focus from the community on doing that and sharing information about how it supports the community.
I'll just add one more thing, which everyone has already, I think, covered all the bases on why it's so important, and how much the advocacy up until this point has been so incredibly impactful and effective. To Dwayne's point, we're here where we are right now, and we wish we weren't here talking about a bill that's already passed the House, but it is by no means done, right? It still has to get through the Senate, likely back through the House. There are changes that are going to be made, and all of the slowdown in this process, all of the pieces that didn't make it into this bill, it's all a testament to the incredible advocacy that's been going on. The only other piece I'll add is just the value of, not only showing up, not only telling your stories, not only continuing to be present and raising your voice, but to bring together your voice with others that you might not think are natural allies, making sure that your legislators are hearing from you as part of a broader unified front against this legislation can be really powerful. You never know like what what story is going to break through for a member or for a staffer. You never know what angle is most compelling to someone, but hearing from the really broad network of advocates about all of these different components and why they're harmful is just really, really impactful to those offices. So just encourage you to continue to speak out. If you feel like you've said it 100 times, keep saying it 100 more times, because it matters, and you never know who's listening or starting to listen or starting to connect the dots. So just wanted to just serve as an encouragement that I know folks are feeling tired, and this has been going on for a long time, but it's because it's working, and just thank you all.
Um, Thank you. Great answers. Great answers. And to everyone who's in attendance, at the bottom of your Zoom bar, there is a box with a question mark in it with Q&A underneath it. Click that if you have any questions that you would like answered. I have many questions, but only time for one more before we open it up to the Q&A. But this is a roundtable, but we'll still have plenty of time for everyone else's questions. Um, Everyone just gave great answers about what's generally going on. But if I want to get more involved with your organization and what your organization is doing to respond to these vulnerable populations, what can I do?
Well, I don't know. I guess I can jump in here a little bit, and this kind of dovetails a little bit into the what we talked about just a moment ago, about what has happened in our state and how we've been leading this charge to fight back against this bill. So the first thing is, there are tools out there to help you get involved. There are organizations. Pennsylvania has quite a number of organizations, like Pennsylvanians Together, for example, is a group of 19 organizations that partner with additional organizations to fight against things like this that really harm everyday working people. And so, gosh, pop it in Google, look it up on Mobilize. It's a tool where a lot of different events are showing up, not just protests, but community conversations, town halls, other events where communities can come together and do things. And so there are these tools out there to find it. And something that I think is really helpful and I think was really empowering, and something that I saw very early on. Fair Share America had asked me, and Americans for Tax Fairness had asked me to speak to this when I spoke with them about what we're seeing in Pennsylvania is, when you say the word Medicaid, what do you think about? And a lot of people think about that's for someone else, right? And the real truth behind it is it's a safety net for all of us. For all of us. I mean, at any moment, we all know that something could happen and we could lose our insurance, full stop. And if that happens, what are you going to do? And that's what Medicaid is for. It's a safety net program. As a kid, I was on it. As a kid, I was on food stamps, the equivalent of SNAP, right? And the average time that a Pennsylvanian is on Medicaid is only around 3 years, because circumstances change, right? And for all of us, it's something like, I think it's 65 or 67%, something over 65. 65% or so of every Pennsylvanian will at some point or another need Medicaid. We heard earlier what the percentage was, I think it was from Jennifer, in nursing homes. It's real. This is ours. This is not, and this is what's being taken away through this ugly bill. And so I think when people realize that, and then it's like, oh, wow, I really do have skin in the game, whether I'm on Medicaid or not, right? Because it is meant for me, my family, my community, and those people that I love. So I think that that's important. And if that means something to you, I say, go to your browser right now and put in, or go to Mobilize and look for events in your area, because they are happening as this fight continues and moves into the Senate. So that's how I'd like to answer that and kick that off. There are certainly groups, and people can feel free to reach out to me too. I can plug you into any place in the state to get involved and to have your voice lifted up, because that's the other thing we've heard through this whole fight. People feel that their voices aren't being heard, and storytelling is so important, as we heard. And we can connect you with organizations like the ones on this call right now to be able to make sure that your story is heard, that it's lifted up, because you are not alone. This is for all of us.
Thank you, Dwayne. Go for it, Adam. And then
So
Jennifer.
I'll get a little more philosophical here, but this idea, and I think other folks have spoken to this, that we are very much in a long fight here. We are attempting to delay this bill, and it is very hard to stay up. So one thing is like even remembering that our politicians and elected officials are humans as well. So even hearing a thank you for fighting, showing up to things, it helps build them up as well for our champions, the folks who voted yes on this bill. The other thing to think about is that, and it's tattooed on my leg. If I ever see you in person, I'll show you this idea that like hope is a discipline, in that like we don't just wake up and be hopeful. We have to be thinking about it and working on it and practicing it. And that's something that we do together in community. And then like the final thing I will say is that when I think about like civil rights heroes for me, it's not MLK, it's not Baird Rustin, Ella Baker, or whoever. It's a woman named Joanne Robinson. She is the Black woman in Alabama who created all the posters for the Montgomery bus boycott. She printed about 20,000 of them. Obviously, this was before the internet, before Mobilize, before texting, and that was the work that she did. So every single person has work that they can do. It might not be sitting on a panel like this, educating folks. It might be working a printing press and making posters for people and talking to people in your communities. So every single one of us has an opportunity to stretch ourselves a little bit and make sure that we're getting the word out about how detrimental these cuts are going to be for everyone.
Yeah, and I would just add, I think a lot of organizations, there's all kinds of toolkits online that hopefully make it really easy for folks to engage. You'll notice across social media, if you're on anyone's email listservs, that there's been coordinated kind of national call-in days for people to lift up and contact Congress. There's, kind of prepared messages to make it really easy for folks to be engaged. And then I think it's also really important for you to ask people in your lives, if this matters to you, you should make sure that people know that it matters to you and encourage them to be engaged on this as well, because it is really, really important that if people have concerns or don't want this to go through, that people in your lives know about it and that they can act as well, because every voice matters in this fight.
Awesome, thank you. And now we'll shift over to some questions from our wonderful audience. And thank you all again for being with us here today. Are there any details about work requirements for people with disabilities who rely on Medicaid to be able to work? And I think, Jennifer, you talked about this in the beginning, but there was an example given about someone who needs support staff while working.
Yeah, so I'm happy to take that question, Mike. So the way that the work requirement, at least you can jump into, but the way the work requirement is crafted is it's meant to only apply to adults who are receiving Medicaid through non-disability pathways. So on its face, it looks like it would not impact people with disabilities, but the reality is that people move through Medicaid and their eligibility categories as their life circumstance changes, as maybe they're more successful in their work. And so in reality, that it means that there's really no way to exempt people with disabilities from these work requirements, because you could be receiving Medicaid through one of these other eligibility categories. And so I don't think for that question that there are any kind of affirmative that you have to keep progressing in your work, but I would certainly say on its face, even though it's meant to exempt people with disabilities, there's no real way to do that in practice.
Great, thank you, Jennifer. Does anyone happen to know the rules of budget reconciliation because it feels like they're overreaching with so many things in the bill that have no dollars attached. For example, AI components.
You can jump in, Adam, if you want to.
No, I was just going to say, can anyone explain the bird provision? I feel like you probably can't.
So I will in no way say that I'm an expert on the Senate rules, but it's a great question because I think what you're getting at is like the reason we're sort of all here under the auspices of the reconciliation process is because of some really unique circumstances that we have right now. So just as a sort of like quick one step back, budget reconciliation is a process by which Congress can move through legislation and they can pass it with a simple majority. So normally in the Senate, there's a 60 vote threshold. So you need to have bipartisan support generally, unless you have a really huge margin between one party and the other. You have to have that bipartisan support to get something passed. The budget reconciliation process allows the Senate to pass a bill with just a majority. When you have alignment among the House of Representatives, the Senate, and the White House of all one party, like we do right now, that really sets up Congress to pass something through this budget reconciliation process because it's much easier to get something done without having to get bipartisan support. Of course, it's also tricky to get all the members of your caucus to support it as well. But so we're in this really specific process around reconciliation because we have this sort of trifecta of one party in control of all of those two chambers in the White House. That being said, there are some really specific rules that apply to this process, especially as it moves through the Senate. One of those Adam just alluded to, which is that there's something called the Byrd Rule. There's a Senate parliamentarian who decides whether things comport with the Byrd Rule or not, and some things that don't have a budgetary impact or outside of the impact of the specific budget reconciliation legislation can be kicked out of the bill. The parliamentarian can say they don't comport with the Byrd Rule, and they're stripped from the bill as it moves through the Senate. There are some pieces that we might see, like the AI component that I think was brought up. There are some things that might get stripped out in through the Byrd Rule as what's known as the Byrd Bath. That's a tricky question because we don't know exactly if and how those things will be challenged as they move through the Senate, how the parliamentarian will rule. And then another wrinkle, I think this Congress is whether the senators will care if the parliamentarian rules something in or out. So there's a lot to sort of like layer on top of what should be some really sort of like strict sort of processes in place to make sure that this aligns with this really specific process that may or may not be met. And we're all kind of just watching and waiting to see. I don't think anybody has any really concrete ideas right now of what might remain in the Senate and what might not. And all that is to say, we also don't know what the Senate will do, whether they'll make changes to what the House sent over, whether they won't. Likely they will. How big those changes will be, we don't know. But I think we can expect to see that legislation be agreed upon in the next week or two. And then that process of moving through the parliamentarian will start from there. We know that they're trying to work under a really ambitious timeline of getting this bill passed in the Senate by July 4th. Whether they can meet that or not, I don't know. I would not have thought the House could have met the deadline they set for Memorial Day, and they did. So I think we can expect to see this move more quickly than we've seen this type of bill move forward in the past. So all that is to say, we're all watching and waiting.
Wow. I can't believe you just broke down over 200 years of senatorial rules in less than 4 minutes and the impact. So thank you so much for that, Elise. I think we only have time for maybe one more question, and there's a lot of questions about the financial costs and impacts, both for families and the impact of shortages on healthcare providers. Um, so if these cuts go through, approximately how many families with members who depend on Medicaid will be affected monetarily, and will these families need to pick up the pieces financially? Dwayne, I think you had some statistics related to that at the beginning of your remarks.
Yeah, I did. And there's kind of a way of thinking about this too. We were at a community conversation in it was either in Bucks County or it was in Bethlehem. We've done them all over the state. And this came up. Oh, you know what? It was in Allentown because the controller from Allentown was there and spoke to this. When these federal budgets are cut, you know, Medicaid is a little bit of a different animal because it's federally funded and state funded. And so, you know, when budgets are cut like this, like who's going to pick up that slack to make sure things are covered, right? And it's either going to be the state, and we just heard the state doesn't have the money to do it. So then what does it fall upon? We just heard how hospitals and medical providers are going to be affected. The other people that are affected are everyday people. So it's either going to come from one of those three places, like maybe part of it picked up by the state, maybe the hospital, you know, can do only so much. There's so many that have closed in the last. I mean, if you know what healthcare looks like in this state, everyone is aware of hospitals which have closed, facilities that are no longer there, or they dial back services and you don't have those services locally. And then it's going to be your families that are going to be trying to keep their relatives in nursing homes because the bills have to be paid in order for those facilities to operate. So I don't have the numbers around that, but what I kicked off the call with was the fact that just the Medicaid coverage from the Pennsylvania policy, we believe that this will strip Medicaid coverage from 580,000 Pennsylvanians, just the way it is. And that's just an estimate. We're looking at the numbers, we're looking what's in the bill and what's happening. We just heard that there could be other things that are pulled in or taken out or changed. But generally, that's what we're looking at in terms of the number of Pennsylvanians regarding Medicaid. The other numbers I gave were relevant to SNAP and to food insecurity and putting food on the table. But that's the number right now that we're looking at is 580,000 Pennsylvanians that currently have health care that qualify for it, but will no longer get it if things are just the way they are.
Wow. Thank you, Dwayne. And despite my best efforts as moderator, I have let this panel down and was unable to get through all of the questions. But tremendous thank you to Dwayne, Jennifer, Elise, and Adam. You've really packed in so much helpful information into just 1 hour. Medicaid, in particular, is a critical program that advances disability rights. And in 1999, the Supreme Court ruled in Olmstead versus Elsie that people with disabilities have a right to live in their communities with appropriate support, and that segregating them in institutions is a violation of the American Disabilities Act. Most private insurance does not provide this in-home support, as you've heard throughout this panel tonight. Medicaid is a linchpin that allows people with significant disabilities to live in their own homes, not just nursing homes. That's why saving Medicaid is squarely a civil liberties issue and of importance to the ACLU. It's also what makes it nonpartisan. Many organizations, oh, whoops, I almost forgot my call to action. I'm asking you to do two things. There will be a slide that shows up on the screen. Thank you. One is a number for you to call your representative, member of Congress. You dial the number you see and enter your zip code, and you will automatically be redirected to your representative. Leave a message and demand that they protect Medicaid at all costs and oppose any legislation that cuts the program. Secondarily, you can click on this link and email your senators and demand the same thing, that they protect Medicaid at all costs and oppose any legislation that cuts the program. And this is nonpartisan action that we are asking people to take because we, the people, will not back down. We can't cut over $60 billion in Medicaid without taking healthcare away from people, very deserving people that the program was intended to protect. Seniors, people with disabilities, and children. And as Jennifer so eloquently put it, people throughout the spectrum of their life. We will demand accountability by ensuring that the government serves us and not the other way around. The power to protect our rights is in our hands, so let's use it. I hope you enjoyed tonight's event. It'll also be posted on YouTube, and we will be sending a follow-up email with more information and answering some of the questions we couldn't get to during tonight's event. Thank you all again for attending, and I hope you have a wonderful evening.